Hi, it's Dr. Danielle Marr and I'm Clinical Director of Dermaface MD Skincare and also Dermaface Clinic since 2009. I think when you go to a practitioner for the first time, I would like you to be equipped with the knowledge and the questions and the education to be able to ask the correct questions. So whether it's first time Botox or you're changing practitioner, I think it's really important to know certain terminologies and just certain ways of doing like things like basic Botox. So Botox is normally used for the upper third of the face. So we can split the face into upper third, mid face and a lower third. The upper face, normally you'll have some Botox here, maybe 5 units, maybe 2, 2.5, 2, 2.5. Then again, sprinkling, depending on the shape of the forehead. And again, get the patient to raise the eyes and you'll be able to tell which muscles are strongest. Sometimes you'll have someone who has an eyebrow that raises higher. So again, a half unit, a quarter and a quarter unit can be quite helpful to flatten that out. But for the most part, if I'm doing my own Botox, it'll be 2 units, 2 units, 2 units, 2 units, 2 units, 2 units, 2 units. And then a little trick is a little half unit high up. It stops at ptosis, which is a droopy brow. Little high, a quarter unit up there as well. Then the crow's feet, you can have a couple of units there, maybe 5, maybe 2.5, maybe 2. And I always find as I come around the corner, I maybe half the units there. Now, if we're going to come to the mid face, the best thing to do here is to have filler. So you can have filler along the nasolabials here and here. And then filler, I think it's great to have filler in the malar fat pad area because as we age and get older, we lose volume in this particular area. And some people want to get some filler in the tear trough. The problem with having tear trough filler is that the skin is quite thin here and you can get that Tyndall blue hue effect where the product shines through. It also requires a really good injector to get this area done well. It's difficult. Sometimes they use cannulas these days. I personally don't like to use a cannula. I want to feel what I'm injecting and I want to feel where the product's going. I can even tell whether I'm injecting with Juvederm 2, 3 or 4 depending on the pressure. I mean, cannula, you lose all touch. So I don't think you should be doing a cannula into this area here. I think it's just much better just to 0.2 ml Juvederm, 0.2 ml, 0.2 ml, maybe 0.1 lessen as you get higher up. Then also something to bear in mind, if you're getting your mid-face done, ask your injector to do it in such a way that it's very natural. I would suggest if you're getting Juvederm 4, split it into 0.5 and 0.5, put maybe 0.3 ml of Juvederm here, perpendicular injection, and just put a bolus or a ball of filler under there that will lift it up. And then as you come down here, maybe 0.2 and 0.1. Some of these people putting loads of filler down here, it just gives it brings the face down. We want everything going up in a V shape. We want the face to be a V shape, not like this. So we want everything up. So again, there's no point putting loads of filler here and dragging it down. You want to lessen it as you get down here. The other thing is when you're doing the lower face and you're considering having your marionette filler done here, again, I just understand how people are doing these crazy big heavy stuff. Use a Juvederm 3 or a Juvederm 2 here and again fan it into the corners to lift up the corner of the mouth. Sometimes as well when people have it falling over, they can have a problem where in there they have angular colitis where the skin isn't getting much air and it can't really breathe. So it's really important to, not just from an aesthetic point of view, get rid of the lines. You want to have your face healthy and